My whole point is there are people out there who had Facebook posts taken down, were called kooks, conspiracy theorists, for saying publicly a year ago what we now say may be possible. And I think those people deserve an apology at a minimum. Thank you.
Juicing up superviruses is not new. Scientists in the U.S. have long known how to mutate animal viruses to infect humans.
And you're on the right side. And I'm your host, Armstrong Williams. Thank you so much for joining us. It's controversial today. Let's get it rolling. Let me read for you. New author Boyd E. Graves exposes African AIDS Holocaust and state origin. Boyd E. Graves, Juris Doctorate, exposes the shocking evidence of a century-long national obsession with biological ethnic genocide. Woo! He joins us, along with our residential physician, Dr. Vaccaro, who has been with the Right Side for years, and he joins us for this provocative discussion. So the government created AIDS.
That's exactly correct.
Spread it.
That's exactly correct.
To basically minorities, African Americans.
Primarily Africans.
Africans, not African Americans.
And also African Americans, of course. But the
Which government?
The United States government in conjunction with a few other governments around the world.
What other governments around the world?
Well, actually, in 1974, they met, the world population met in Bucharest, Romania for a World Population Conference. Many of the governments, even those of Africa, were there. And they did, at that time, decide on a population reduction, population control
So Africa was
plan.
a part of this?
Absolutely. Oddly enough, though, the leaders in Africa at that time, many were puppet dictators. And so, in a sense, there were no true governments in Africa, but they did join in on the plan to cull their populations.
Their credentials, sir?
My credentials are is that I'm a graduate of the United States Naval Academy, as well as a graduate of law school. I'm in my third year as an International Medical Research Director for the International Medical Research Foundation, the Common Cause.
But you're not a physician?
I'm not a physician as such, no.
Continue, please.
Yes, the U.S. Special Virus Program began in 1962 and persisted for the next 15 years until 1978. It produced 15 yearly progress reports of the program, which detail nearly every experiment and every contract. We have also found the budget for the program. They spent $550 million to make the HIV enzyme, and that investigation is currently underway with the General Accounting Office. This special virus program is for the purposes, whether it comes through sex, whether it comes through the air, there appears to have been a federal program that made a virus.
No. Now you say there appears to be.
Well, there's
you were
proof.
emphatic before.
It's absolute.
Proof or not? Okay,
there's
so
absolute evidence
okay.
of a federal virus program, sir. Let me state for the record what the information is.
Okay, for the record.
The U.S. Special Virus Program began officially in 1962 and ended in 1978. It produced 15 of these progress reports, some of which are some 400 pages apiece. It details every experiment and every contract, and it also has a flowchart document, a blueprint to develop to develop a virus that depletes the immune system.
How long?
We want this program reviewed, sir.
I don't believe that any nation, and especially the United States of America, introduced the virus into Africa. And I don't think our philosophy of government, our philosophy of morality, sustains the belief that our government, or any person in this government, is waging a war against minorities, and especially African Americans and native black people. I cannot believe that. And especially I cannot in any way even think or conceive of the notion that our great nation, which has imperfections, would do such a dastardly deed. I believe firmly that this germ, virus, is spread through sexual indiscretions, and I also believe that the nations of the world, aside from the United States, would not participate in a waging war of this type.
Is that right, Doctor? Well, in this regard, though, the public law signed by Richard Nixon on March 16, 1970, authorizes population stabilization. And as I understand it, there are two means of doing population stabilization, either mass increase in the death rate or mass decrease in the birth rate. We believe that we can show epidemiologically that there has been mass increase in the death rate, particularly as it relates to sub-Saharan Africa, as a direct result of U.S. policy. Public Law 91-213.
Well, that's a different situation. That's not virus. I believe the depopulation of the world is due to abortion, which is an abomination. That is destroying people more than, as you say, the virus, which I don't accept.
Yes, sir. All I would say, though, in response,
Yeah.
is of the 15 progress reports of this secret federal virus program, how many have you personally reviewed?
I personally
Yes, sir.
reviewed?
Yes,
I
sir.
reviewed none.
Yes, sir.
I'm
And in
using
that regard-
well, just a moment.
Yes, sir.
Here. Gain-of-function research, as you know, is juicing up naturally occurring animal viruses to infect humans. To arrive at the truth, the U.S. government should admit that the Wuhan Virology Institute was experimenting to enhance the coronavirus's ability to infect humans. Juicing up superviruses is not new. Scientists in the U.S. have long known how to mutate animal viruses to infect humans.
Of the schematic of the federal program, this is what it looks like. And you see a big old rat over here, but you see a human over here, you see a vial here, but you see something very strange at the top. Now, I recognize that I'm in a land of Bible scholars, am I right? And I'm just trying to make sure. I'm in a land of Bible scholars. Because the Bible has some things in it that appear to be predicatory. And one of those things is a number. There's a number associated with the Bible, isn't there? 666? Well, I'll show you something how heinous this government is. On the cover of this U.S. special virus program are these little microplasmas here at the top of the noon hour. And they are six-sided figures, correct? And there's 3 sixes there? 666 at the noon hour of the U.S. Special Virus Program. That's how in your face this federal program is. 666 at the noon hour of this federal program. That is just how heinous this federal program is. Now you're looking for your 666? Well, now you done found it. And now that you done found it, it's time for you to do something about it. Or what? The beast wins? It appears to me I don't want the beast to win. But this federal program needs to be reviewed now that I know that you got 666 on the cover.
We had a really extraordinary meeting.
One familiarity gives Graham comfort. It's seeing Dr. Anthony Fauci and Dr. Deborah Birx.
Thank you, Mr. Vice President.
Each day during the presidential press conferences. Both were leading researchers combating AIDS. Today, they're guiding us through the coronavirus.
These are two.
This would not be the first time, if it happened, that a vaccine that looked good in initial safety actually made people worse. There was the history of the respiratory syncytial virus vaccine in children, which paradoxically made the children worse. One of the HIV vaccines that we tested several years ago actually made individuals more likely to get infected.
Mike, welcome to the show. We appreciate you being on tonight.
Thanks for the invitation, Joe.
Okay, let's talk about the rat of the week. Why is Bayer Corporation the rat of the week?
Internal documents show that after this company positively, absolutely knew that they had a medication that was infected with the AIDS virus, they took the product off the market in the U.S. and then they dumped it in France, Europe, Asia, and Latin America. The medicine's called Factor 8. It was an injection medicine that was used for hemophiliacs, mostly children. Children had been born with an incurable disease.
Hold on, Mike. So, hold on. So you're telling me that Bayer knew that this drug was infected with the AIDS virus. They yanked it from the market in America, and then they dumped it in markets overseas?
They had to figure out a way, Joe, to make a profit on a product that they could not sell in America. So they made a huge profit. They dropped the product in Japan, Spain, and France. By the way, Joe, government officials in France that allowed that to happen actually had to go to prison for it. In America, not one corporate executive for this company has been indicted or even criminally investigated by our Justice Department.
Why not? You're telling me that these people that dumped this AIDS-tainted blood in foreign countries, who killed children, have not been taken to task in the United States?
It's worse than that. The U.S. government allowed it to happen. The FDA allowed this to happen. And now the government is completely looking the other way. Thousands of innocent hemophiliacs have died from the AIDS virus. And not only they're dying, their family members are dying because they're becoming infected with the disease. This company knew absolutely that they had a problem with the product. They knew that it was infected with AIDS. They dumped it because they wanted to turn this disaster into a profit.
Mike, I want to read to you what Bayer told the New York Times about this scandal. They said Bayer behaved responsibly, ethically, and humanely. Decisions made nearly 2 decades ago were based on the best scientific information of the time and were consistent with the regulations in place. That sounds like a lot of legal mumbo-jumbo. Now, you say you have internal documents that show that they knew that this drug they were dumping was tainted with the AIDS drug?
Or
the AIDS virus?
The documents show that there was no question that this company absolutely understood the risk, that they knew that it was contaminated. It wasn't a possibility. They knew it was contaminated. Americans were dying from the product before it was pulled off the market. The only reason it was pulled off the market is because lawyers found the documents and showed it to the government, and finally the government said, you can't sell it here, but then the government allowed them to dump it in Spain, France, and Japan.
That's amazing. That's just amazing.
Well,
I want to read to you what the New York Times said, and this is an investigation that they also did, and they said the federal government was part of the problem while the Food and Drug Administration told the company not to ship the drugs overseas. The man responsible for the drug supply, quote, asked that the issue be quietly solved without alerting the Congress, the medical community, and the public. This is a cover-up, and our Congress is not doing anything. What should Americans do?
This is utter madness. This is science gone absolutely mad.
The shape of the coronavirus spike protein before the virus meets our cells is what triggers the most protective antibody response. So Keith must make the spike protein in the lab, locking it into exactly the same shape by adding another protein that acts a bit like a clamp. And that protein is a tiny fragment of HIV.
The reason we chose this protein is because it's so well understood. It's a highly stable structure. There is absolutely no risk from this type of vaccine. There's nothing that makes HIV replicate.
Fucking rubbish.
It was a race against time, and back in January, University of Queensland virus experts were confident.
We're aiming to have something that's ready to go into humans in 16 weeks' time.
And in early clinical trials, it looked promising.
The vaccine was shown to be safe and extremely well tolerated in all of our vaccinees.
216 people in all. The problem was the use of an HIV protein used in the molecular clamp technology. It was a small fragment of HIV, and scientists were aware of the risks of false positive results.
There was a theoretical risk of this, we thought, albeit a very low risk.
In a shock result, everyone who had the vaccine came up with the false positive. The federal government was told on Monday, and jointly today with CSL, it was decided to halt the project.
The risk to vaccine confidence was the principal issue here.
It was a very, very good technology. It was looking like it was going to make antibodies, and it probably would have worked very well as a vaccine.
But it would have been hard to convince the public it was safe.
It's certainly a tough day for the team to get this news.
Especially seeing the very positive data come out of the trial. It's a very sad time, but also we're very proud of what we have achieved.
Trial participants didn't know if they were taking the vaccine or a placebo.
It's just such a terrible shame that it is ending this way, but I would do it again in a heartbeat. I have no concerns about recording a false positive.
Heather Shearer says researchers were very upfront about any risk.
I knew that they were using a modified part of the HIV virus, but the actual possibility of getting HIV was impossible.
The UQ scientists are leaders in clamp technology and did have other options from the start.
In hindsight, the UQ team, of course, it's a wonderful thing. We would look back and perhaps change the molecular clamp that they were using because there are other options. But they went ahead with this, and everyone knew that this was a possibility because patients were warned about it.
The Queensland government invested $10 million into the research with no regrets.
They've been working night and day. I mean, they have been making the ultimate sacrifice. But of course, there are going to be some winners and losers when it comes to vaccines.
What has happened today is not a surprise to the government. But what is important is that the plan was in place to deal with this.
So the race for a vaccine continues.
I think the world is in safe hands as we bow out of this project.
Lexi Hamilton-Smith, ABC News.
Chuck Todd is on NBC. Chuck Todd can't figure out why people are losing faith in our institutions. He can't imagine why people are losing faith in our institutions while he lies and while he encourages lies from Fauci. So here's the interview.
What is your level of concern that we're going to discredit public health officials to the point of, look at Russia. They actually have a good vaccine, and none of their citizens will take it because they don't trust their own government.
Right. It's very dangerous, Chuck, because a lot of what you're seeing as attacks on me, quite frankly, are attacks on science. Because all of the things that I have spoken about consistently from the very beginning have been fundamentally based on science.
The Special Virus Program is only part of a sophisticated scheme to cull humanity. This court cannot deny the existence of this program with the current submission of the 1971 flowchart. The experts have reviewed the flowchart, and it is authentic. The Special Virus Program isolated, stabilized, and mass-produced a leukemia lymphoma virus. Plaintiff brings to the court's attention that HIV was originally called leukemia lymphoma virus. And each of you tonight is receiving a copy of this flowchart, but I wanted to put it on the record in front of the camera as well. Here is the 1971 flowchart. This is the United States government document. It takes the research logic of the Special Virus Program from A to Z. The people have definitive proof of another non-public human subject experiment gone awry. We have compensated our victims before. We must do so again. The Constitution requires it. The heart of true America compels it.
Save a life. Yeah, y'all ain't right.
The U.S. Special Virus Program. Anyone can access it through the World Catalog database. You call your librarian, ask her or him to look into the World Catalog database and put in Special Virus Cancer Program. What you'll find through the public library system, there are 8 of the 15 progress reports of the U.S. Special Virus Program that are accessible to the public through the public library system. And that's in addition to my website, BoydGraves.com, because that's there. The experts' opinions are posted. You may not like me, the messenger, but it is not about the messenger. Here is the federal